It's also recommended that we train all dental healthcare personnel in the use of PPE and to follow the recommended sequence for donning and also removing. So for putting on the PPE and taking it off, there are specific recommendations, and those can be found at the URL listed here. So the sequence here is, this is where we're really a little bit different than what we've been used to in the past. You know, typically in dentistry in the past, we'd seat the patient in the dental operatory, maybe sit down and talk to them for a while. We'd probably have our gown on already, but then we would wait until after we talked to the patient to put on all the other PPE. What they're recommending now is that you go ahead and have the patient be seated, but before you enter the room or the care area, if it's an open bay, that you would first perform hand hygiene. Then put on your clean gown or protective clothing, you know, that gown again that they've specified as neck to knee and to the wrist. And it needs to cover any clothing or skin that could be soiled during treatment. The gown and protective clothing should also be changed if it becomes visibly soiled. Put on a surgical mask or your respirator. Make sure that the ties are secured correctly on the crown of the head and the base of the neck. Or if it's an ear loop, you know, make sure that they're hooked correctly around your ears and that you're not twisting the loops or otherwise manipulating the mask in a way that it's not intended to be worn. The respirator straps, you place your respirator on and you put the lower strap on first, and then you put the upper strap on. And you perform a user seal check each time. It's not the same as a fit test. A user seal check is just the person who's wearing it does a quick check to make sure that it's sealed each time they put on a new respirator. Then put on your eye protection and then perform hand hygiene. Again, you can use an alcohol-based hand rub for this if you want to, and then put your gloves on. And now you're ready to go to work. If the gloves become torn or heavily contaminated during the procedure, go ahead and change them and now enter the patient room. After you've completed dental care, and you've dismissed the patient, you then remove your gloves and then carefully remove your gown or protective clothing by turning it inside out, and then discard your disposable gown after each use. Prior to this, the CDC recommended to use gowns, to change gowns at least daily or more often if they become visibly soiled. Now they're making a recommendation that you would discard a disposable gown after each use, and you would launder cloth gowns after each use. Now you exit the patient room or the care area and perform hand hygiene. Carefully remove your eye protection by grabbing either straps, if it's a face shield, or grabbing the, grabbing around the ears for goggles or glasses with side shields. If you have reusable eye protection, you can clean it, disinfect it according to the manufacturer's instructions, and then discard disposable eye protection after you've used it. Remove and discard your mask or respirator, and do that by carefully grabbing either the ear loops by your ears or grabbing the straps behind your head and carefully removing it from your face without touching the front, and then discard it. And now again, perform hand hygiene just in case you accidentally got any contamination on your hands during this process. This is all spelled out in the CDC guidelines, so I really encourage you to go to cdc.gov/oral health and look for these guidelines.